Ladies and gentlemen, warm welcome. My name is Michaela Anneling-Swan. I'm a Regional Director at Swecare Foundation, and I will be the moderator of this event and guide you through the afternoon. But in short, the program will be focusing on the two reports being launched. We actually had them from the printing facility at 12:30 today, so they're really fresh from the press. Most of you were actually part of the Ukraine conference that we did together with the Ministry of Health and Social Affairs in December 2023. Since then, we've had workshops in March. We have had 3 webinars and a lot of things happening. And in the end of the spring, as Maria said, we were lucky to get the decision on additional funding for our Ukraine project. And these 2 ladies joined the team, which was, getting muscles to all the efforts that we are putting into towards Ukraine. And we're super happy to have both of them joining the team. We've been in touch with a lot of key opinion leaders in Ukraine, listening to their needs, and we will do our best to match it with the private sector and the government's interest, all in line with becoming EU members moving forward. But with that said, Katerina Pavelkov, warm welcome up on stage. Your report will be the first one, but before that, one of the key reasons for this event is also because we want you to connect with Katerina and Anastasia, because they are really the brains behind, of course, the reports, but also for all the contacts and connections that we have with Ukraine, and a lot more information that's covered in these reports. So make sure to, network with them and get to know them, because they are true sources of information. But Katerina, please tell everyone who you are.
My name is Katerina and I'm from Ukraine. I came here 2.5 years ago, since full-scale invasion started in Ukraine with my 3 children. And my professional background in journalism and communication. And in Ukraine, my husband and I, we had our video production business. And also I had an opportunity to be a part of press service of National Health Service of Ukraine when reform of healthcare started for 2 years. And then also I had an experience working with NGO that promoted topic about palliative care in Ukraine. And all these professional and my passion projects give me a lot of contacts in healthcare system in Ukraine. And I really admire people who work in healthcare in Ukraine. And I am so happy that here in Sweden, where I am, because of such a sad circumstances in my country, I can be useful. I can share my knowledge about our country, about healthcare, and also I can bring some connections that can help my country. And also, I believe in this with all my heart, that it can be useful for Sweden also, because we live in such a strange world and this news every day. And I think that Swedish people can be more prepared for unstable future, having communication with Ukrainians. As a journalist and as a communicator, my main idea while I looking for data and trying to describe facts about healthcare system in Ukraine, I always try to predict what these numbers and what these facts may actually show you about my country, and what actions or inaction they might inspire in you. And it's too easy to lose people behind the numbers, whether in healthcare, in reforms, immigration or war. As you read this report, please keep in mind the people that stand behind the Ukrainian healthcare system. Public servants, medical professionals, patients. They all are real, living, imperfect people who are rebuilding this system, who are working in it every day. And they providing every bit of possible help right now. And I'll also try not to forget the past of Ukrainians, because our history has long included many of the horrors now you can see in the evening news, and sometimes through our history it sometimes has been even worse. But we continue to live and we strive for development. And this is a photo of my son. The idea to put a picture of child on the report about healthcare system gave me my colleague from Swecare, Cecilia, and I'm really grateful to her for this, because it's so easy just to lost yourself in this horror news and so on. But she told me that everything we are doing, in the end, we are doing for our children. And also, I really want to say that we want to ensure that everything that happens right now, it will never happen again, for the sake of them. So Dari was born with the anomaly of kidney. And when he was 7 months old, he had a rather complex 2-hour surgery on his kidney. And despite the bold message in Ukrainian constitution that healthcare for Ukrainian citizens is free, for the operation to be done on time with proper quality of the care, my family had to pay the surgeon $300 and also out of pocket. And also we had to buy all the necessary medications. And because of this, the nurses were kind to me, and also the doctor was kind to me, and he heard my request and didn't place my son in the intensive care unit after the surgery, like protocol says. And he allowed me to stay with my son the entire time, because in Ukraine, because it's why it's so crucial, because in Ukraine at that time it was forbidden for members of the family to be present in the intensive care units with their beloved people, and it's like the worst punishment for mother. So my little son recovered from anesthesia very easily, largely because we had paid for the most expensive drug. And meanwhile, my roommate was in tears because her child had reacted poorly to another type of anesthesia after receiving care for free. And I felt relieved knowing that in this system that didn't work properly, I had found the best solution for human being that I love. And 4 years later, I witnessed the start of the reform of healthcare system in Ukraine, working in the press service of the National Health Service of Ukraine. And it was established in 2018 as the country's single national purchaser of healthcare services. At the time, I also clearly understood that what I had done for my son in this hospital, it had been my own contribution to the corrupt practices that so often destroy everything good in my country. And I was so glad to be part of the changes. And the reform marked the beginning of a new era in Ukrainian healthcare system. Finally, after years of struggle of patients, organizations, and medical professionals, the government acknowledged that the idea of the system where everything is guaranteed to be free for everyone, it's a myth. Instead, the focus shifted to what Ukraine as a state could realistically afford and what cannot. From the Soviet Union, our country inherited a very large system of hospitals known as the Semashko system, by the last name of the Soviet doctor that created this system. It was a system with sounds of large gray buildings with long corridors, creaky beds, outdated equipment. I found information that number of Ukrainian hospitals at that time exceeded the number of hospitals in the United States around 7 times. And one theory justifying this number is that the Soviet Union was always preparing for war on a foreign soil in Europe. And Ukraine was always on the border between light and darkness. And this large number of hospitals was meant to treat wounded Soviet soldiers. So the Semashko system was highly centralized, with all hospitals owned by the state. And there was no competition between healthcare providers. People could only receive primary care based on the place where they lived. So if you lived in a small town or a village, your prospects were grim because quality care was available only in regional centers and in some cases only in the capital. Before the reform, we had even such a joke. Why don't people fall off the earth when it rotates? Because they are attached to their polyclinics. So we were so strong connected to the hospital, and patients, they didn't have a choice. They couldn't choose their doctor or healthcare providers. So healthcare institutions were always filled with thousands of exhausted medical professionals. The salaries of healthcare staff before the reform were among the lowest in the country. A doctor earned about 7,000 hryvnias, and it's around 1,800 kronas. It's like the same amount that Sweden per month, yes, the same amount that Sweden currently supports Ukrainian refugees here. So in other words, it was impossible to live on that income, even in Ukraine, even in that time. So the desperation of the medical staff in 80% cases, along with the lack of medicines and equipment in hospitals, led to a terrible outcome. Almost 50% of all healthcare expenditures in the country came out of the patients' pockets who were just as poor as the doctors. And I just want to show you this data from World Health Organization. You can just compare years, numbers of finance that your country and our country had for healthcare in the different years. So 2017 reform began, and it started to change the Ukrainian healthcare system, guided by the motto, "No force on the earth can stop an idea whose time has come." And this motto was used by a small team of reformers led by Uliana Suprun, an American medic with Ukrainian roots, who served as Ukrainian Minister of Health for almost 3 years following the Euromaidan and Revolution of Dignity. And this was, in fact, the longest period of a health minister in Ukraine history, with only Viktor Lyashko serving longer right now during the war. And such kind of frequent leadership changes meant that there was little sustainability in the healthcare system in Ukraine. And this Sunday, I tried to find a way to present the main actors in the healthcare system and their connections for the patients. And I was trying to find a simple and understandable way to show you our system. But yes, it was like something in my mind. It's in Ukrainian. But in truth, I believe, and also I post this drawing on my Facebook page, and I got a lot of impressions from Ukrainians. Someone supported me, someone said that no, our system is good, or something like this. But to be honest, I believe that our system isn't more complicated than the Swedish one. It's just not as well organized yet, especially in the midst of the reform that truly turned everything upside down. And it's like more cultural. Yeah. So what was changed? The reform changed the entire principle of healthcare financing in Ukraine. Since 2018, Ukraine has implemented money follows the patient model across primary care, outpatient treatment, complex surgeries, emergency care, palliative care, rehabilitation. And this means patients gain the legal right to choose their doctor and healthcare provider, with the state paying for specific services. This change fostered healthy competition among healthcare providers, and it pushing them to compete for patients through better through better service quality. All public hospitals previously owned by the state had to become non-profit municipal enterprises owned by the communities. Also, reform gave hospitals autonomy, and their directors or leaders, they became managers responsible for deciding how to spend the funds paid by the state for treating patients. Hospitals gained the right to have private bank accounts, because before they have accounts in state treasury, which meant now they could use the funds to raise salary, make repairs, provide organized procurement, buy new equipment, or even save the money for future development. And in many hospitals, good managers already raised the salaries of their team 10 and even more times, sometimes, among the Ukrainian hospitals. And additionally, the state could no longer seize unspent funds at the end of the fiscal year, as it had been the case with the state treasury accounts before. How hospitals manage their money also no longer impacted the funding allocated for the state program of medical guarantees that also started in Ukraine with the reform. And it's the scope of medical services guaranteed free of charge by the state and funded by taxpayers. In 2024, this program covered 44 medical service packages across various levels of care. Both private and public hospitals now can, if they meet the requirements to provide such kind of services, and if they are connected to the electronic healthcare system in Ukraine, they can sign contracts with the National Health Service of Ukraine and receive payment for the services they provide. So now competition starts not only between municipal hospitals, but between private and municipal hospitals. So it's like more aggressive competition right now. Currently, all services are recorded in the electronic healthcare system, and payments to healthcare providers are based on this transparent data. Since the National Health Service of Ukraine began operating, there have only been 1 or 2 cases of payment delays, and even then only by a few days. Before the reform, delays of wage payments from the state treasury could last for months, sometimes even years. Yes, and here you can, it's a rough outline of how the healthcare system operates today. So the Ministry of Health is responsible for developing policies and healthcare system and healthcare sector, while the National Health Service of Ukraine functions essentially as a national insurance company, ensuring that not everything, but the most crucial services provided to patients will be paid for by the state. With the reform, Ukraine also introduced an electronic healthcare system, e-health, which operates as a public-private partnership. The Ministry of Health sets the policies for its functioning, while the National Health Service of Ukraine they owns the entire database of medical records. The state enterprise e-Здоровье manages the technical aspects of the system without any connections to sensitive data. And also, we have a lot of private companies that they developed medical information systems to and they offer their product to hospitals and pharmacies, enabling access to e-health. As of today, there are around 40 such systems in Ukraine, and healthcare institutions choose which to use, with the National Health Service of Ukraine ensuring secure data transmission through this system. As of August 2024, the e-health system in Ukraine has registered 35 million patients, thousands of healthcare institutions, including hospitals and pharmacies, and tens of thousands of doctors and nurses. This system supports the entry of electronic prescriptions and referrals. And all the numbers, including payments made, can be viewed on the website of National Health Service of Ukraine on their dashboards. And it's really amazing to have such kind of things in Ukraine. Unfortunately, these dashboards in Ukrainian. And it's a significant step toward transparency and fighting corruption in the healthcare system. And another major development was the creation of the State Enterprise Medical Procurement of Ukraine, MPU, which became the sole purchaser of medical supplies and medication for state hospitals. Before the reform, the Ministry of Health managed all procurement, and it led to widespread corruption. For example, during Yanukovych presidency, the health minister bought vaccines with a low quality from a company owned by her son. In the transition phase, patient organizations, active advocates and watchdogs in Ukraine ensured that all medical procurement was entrusted to international agency like USAID. And they procured some medication and medical products for Ukraine for some time. But for the last 3 years, MPU has been purchasing all medical supplies through the Prozoro. It's a public electronic procurement system. And it's also helping to reduce corruption. And thanks to the work of Medical Procurement of Ukraine company or state enterprises, tens of millions of hryvnias were saved. And the work of the Ministry of Health and National Health Service of Ukraine is closely linked with the Ministry of Finance, of course, which allocates funds for the state program of medical guarantees. And the Ministry of Social Policy interacts within the healthcare system in areas such as rehabilitation, prosthetic, mental health, elderly care, and one forecast for the post-war future connected to this is that around 15 million people may require psychological and even psychiatric assistance after the war. Additionally, the Center of Public Health Center is responsible for prevention, epidemic response, and vaccination. Local governments, you can also see them here. They play a significant role right now in healthcare because they are legally owners of the hospitals. However, there are many challenges. They are still learning how to manage healthcare because, as I told, all system was very centralized through the many years. And at the regional level, also we have health departments within local state administrations. They oversee the implementation of Ministry of Health policies. For scientific and clinical expertise, drug registration, and the regulation of medical products, 2 state services under the Ministry of Health are responsible. The State Medicine Service and the State Expert Center. So I want to add that in Ukraine we indeed have a well-developed system of medical education, which includes 2 academies, 13 medical universities, and around 100 pharmaceutical and nursing colleges and schools. Also, the form of professional association for doctors and nurses is widespread, and Ukraine has dozens of such association. Currently, the law on medical self-governance is being actively discussed, which will be based on such professional associations and will provide for their role in ensuring the quality of medical care and protecting the interests of medics. But the largest positive trend is that the system stays resilient during the war, and it's because due to the incredible spirit of the civilian and military medics, and also there is still a strong will to continue the reform. And right now, the reform is entering the third step of the transformation, and departmental hospitals, which were owned by different state services and other ministers, and they still were not included into the reform, and they didn't have contracts with National Health Service of Ukraine. They right now start to do this. For example, such a crucial institution as National Cancer Institute entered the reform last year, and now it is providing 16 various packages of services for free. And in the past, it was connected with a lot of corruption cases. And I believe that there are also a window of opportunity and for Ukraine and for our foreign partners, because due to the war, the urgent political decisions needed for development can sometimes be made very quickly, especially when it concerns our path to the European Union. And also, there are a lot of needs in Ukraine right now, but also we have financing from our foreign partners. And I think that the strategy, Build Back Better, opens many opportunities for innovations and building a green economy and more efficient solutions in Ukraine. To be honest, I'm an optimist, and I believe that ongoing reform will bring Ukraine in a better place after the war. And I have the last slide. Oh, it's like takeaways, but yeah. So I just want to leave you with this quote, and I want to tell it to those people who will pitch today, because if there is time for your idea, no one can stop it. And also, if there is time to stop Russian barbarians, no one can stop it.
Thank you very much, Katarina. But then let's move on to Anastasia Flanagan to talk about funding opportunities for Swedish life science companies.
So, Ukraine. Ever since the beginning of the invasion, it has been the beneficiary of our help and our compassion. Oftentimes, all of us have been asking ourselves, what is it that I can do to help Ukraine? Am I doing enough? But today, I would like to talk to you about something else. I would like to help you see business case Ukraine rather than charity case Ukraine. And my name is Anastasia Flanagan, and I've been working in life science companies in pharma and medtech for the past 15 years. And my roles have been mostly in business development and marketing. My primary education is in linguistics, and I've been living here in Sweden for 8 years. So I feel truly like a Ukrainian Swede. I have also had the opportunity to see the Swedish healthcare system at first hand and the Ukrainian healthcare system at first hand as well. But let me tell you this. We think about February 2022 as the time that the Russian invasion on Ukraine began. But it isn't the Russian invasion on Ukraine, it's the Russian invasion on Europe. And Ukraine has borne the brunt of that. And I think given that, it is absolutely amazing how resilient the system has been and how it has stood its ground. And the hospitals are operational, they're receiving the medication, they're giving patients treatment. You know, people are not dropping like flies just because they come to a healthcare facility, nothing's going on. Despite the incredible human suffering, despite the catastrophic financial losses, Ukraine and the healthcare system is fully operational. So that's the first thing that I would like us all to be clear about. The infrastructure that we have and the conversation partners that we have in Ukraine, that is about 10,000 healthcare facilities, more than that actually, of different forms of ownership. I would like to talk to you today about different types of procurement and question where is the money, so I hope we can answer that a little together or at least get an idea. And also who dispenses the money, who is it that decides. Our hope of the outcome of this report is a little bit of a better understanding that we achieve together of the structure of the Ukrainian healthcare market. We would like to see it as dynamic, and we would like to see it as a market that has a capacity and a need for Swedish solutions. Also, there will be a lot of situations when there are and there will be no domestic alternatives for the Swedish solutions in the near future. Let me be clear on this as well. Ukraine needs you. Ukraine needs your support. Ukraine needs your product. Let's see if I can back this up later as we go. What did I say? So this is the lazy dog, the lathund. For business case in Ukraine, you will see a lot more of this in the report. So this is like the outline that will maybe help get the answer to the question, where is the money and who disposes of the money? Starting maybe clockwise, left to right, like that. First we have the MPU, the Medical Procurement Agency of Ukraine. Katya mentioned that in her report. It's a newly created agency from 2018, and they manage centralized procurement when you have socially important and significant diseases such as tuberculosis, adult oncology, hemophilia, pediatric oncology. So they manage that from the state budget. Then we have the state-funded entities. That is all the hospitals owned by departments and agencies, but also owned by municipalities and communes, which have agreements with the state. This is the bulk of the medical institutions that we will be talking about. They receive money from the state budget as well. And you know that, why do I have international grants and loans over there? Because all the military needs that Ukraine has, they cannot be funded by foreign aid directly like that. So they cannot fund with money rockets that Ukraine manufactures. So all the military needs are funded by the Ukrainian budget. And the money from the aid agencies often goes here, and that can be grants and loans as well. Then we have international agencies like USAID, like World Bank, like the German Corporation Agency, and a lot of others working on that. Then we have direct procurement from charities and NGOs. Then we have donation. And we have private purchase, which then is represented by two things, I would say. The network of private hospitals and private outpatient institutions in Ukraine. Can you imagine if 49, I had a report from SafeMed which said over 60% of expenses for healthcare is funded out of pocket. How's that? Where does that go? That goes to the private hospitals. There are also people go to the pharmacy. You come to a doctor and it says, you need antibiotics. You go to the pharmacy and you probably will have to buy it by yourself. So 47 to 49%, that's a massive budget that sits in there. And of course, the source of that is private capital. That's people's money, and that's those private hospitals' money. All lead to where we want to be, to the supplying of your medical product. This is a really rough classification, but all the buyers and all the channels, I would say, are divided into two parts. Over there, those that always use competitive tenders. And these are, of course, the international agencies, such as USAID, the European Bank of Reconstruction and Development, but also some of the hospitals, which are the state-contracted hospitals, municipal contracted hospitals, and the medical procurement. So that's competitive tender. Here, it doesn't mean that there's never competitive tender, but it's like, It's charities, it's people buying things from distributors via pharmacies, and it's also private hospitals and private polyclinics. I know that some of you have actually worked in Ukraine already or have plans to. And this is my question back to you then. Have you engaged or are you thinking of engaging any of these channels for your product? Maybe with time, I will still get you talking, because I think that, my own comment on all these channels and all these methods of getting your product to Ukraine, going back to the previous slide, looking at the easy pick, that would be the one at the bottom, pro bono donation. Now, in the report, you will find a more or less detailed breakdown about what is good and what is bad about that method of getting your product to Ukraine. Pro bono donation, it is appreciated. It's humanitarian. It's also easy because, as an example, NGOs purchasing prosthetic equipment, they look at what requests are coming from people. They're not necessarily looking at the price. This is where, on the right side, you do not face such a price restriction as you do on the left side. Of course, medical market always price sensitive, but state-owned, municipal and community-owned hospitals that operate via Prozoro, in Prozoro they are obliged to use price as the main criterion, even though there can be a shift and there can be room for life cycle costs. But on the right, if you're a private hospital, and just as an example, we don't have anyone from Elekta here today, but they would confirm what I'm about to say. The first sale of an Elekta device to Ukraine was to a private hospital. So it's on the level where private institutions can afford that type of investment. How strong is the private sector exactly? And this is just the highlight. The report focuses on all the actors and all the procurement channels, but I think this is a stark difference to what we have in Sweden. You could not dream about going to a Swedish private hospitals and say, someone needs radiotherapy, chemotherapy, and surgery on their liver. That would not happen. This is the kind of competence and resource that you have in the state system only. In Ukraine, you can see hospitals. We have 176 privately owned hospitals that we are aware of. We have 1,580 outpatient facilities, and we have almost 5,000 private practices. That's what the system looks like. Is that a big difference? What do you think?
Sounds expensive.
It does. And we found that as the trend for healthcare expenditure in the GDP is dropping, so it's a downward curve, the trend for household expenditures is unfortunately growing. And a lot of people are facing catastrophic healthcare expenses too. So what are the recommendations? I mean, basing on, I would say, this. Very, very heterogeneous, very, very varied and different ways of coming onto the market. It is always really starting with identifying the need and starting at the bottom, looking at who is it that needs your product and who is it that has access to the finances. How would you find that person, or how would you, not the person, but how would you find that institution? I hope that the report answers that to a degree. You would find them in the information in the online dashboards of the Ukrainian Ministry of Health that, for example, explains then which hospitals works to provide treatments for which diseases. That's one way. USAID is a major actor in the upbuilding of Ukrainian healthcare, and they have been for a long time. In fact, they are the agency which is behind the systematic support to the medical procurement, to the MPU here, also to the first Ukrainian HTA, Health Technological Assessment Authority, and a number of other positive policy trends and modern innovations in how the healthcare system is built. They run this via projects. So for example, there is a USAID project that is called SafeMed. And it provides, the goal of that is to provide Ukrainians with affordable medicines that treat very specific, very widespread and diseases with a high level of morbidity. So SafeMed project is implemented by management consultants for health. So you have USAID, and then you have the project implementer. Management Sciences for Health then liaises directly with medical procurement of Ukraine. But that's not something that they can do on their own. Then they go out and find subcontractors to deliver solutions to the medical procurement of Ukraine, to help them in various ways. We know of a company, and this is actually a Swecare member, that delivered that IT solution to medical procurement of Ukraine within the framework of the USAID project. So this is real. And Swedish companies have done that, even though Swedish companies have historically been really, really shy when it comes to presenting what they can do to the World Bank and to other actors. I don't know why that is, but I think it is a trend that we want to break. So you have heard by now from me that Swedish companies have delivered cutting-edge medical technical solutions to Ukraine, and also IT solutions and services that work directly towards the Ukrainian government and the Ukrainian government structure, and they provide value. Because, I mean, this is also a very important focus for us and for our projects. By connecting you to the Ukrainian health system and by helping you platform your solutions, we would like to contribute to the development of sustainable healthcare in Ukraine. It's not just something there for one day. People will always get sick. People will always need treatment support that is continued and that is better than what we had before. Because how is it that Ukraine has 7.5 hospital beds per 1,000 people, and Ukrainians live to be, here I'm looking at, do you know what life expectancy is for Ukrainian men? What's your guess? You knew. No. Yes, correct. I have here 65.4 years. Female, 75.8 years. A lot of thoughts can, how is that possible in all those YouTube videos of why women live longer than men? But that is a very low life expectancy compared to, for example, Sweden. So a Swedish man can expect to live almost 20 years longer, whilst the number of hospital beds is so much higher per person. So you can just imagine what it speaks about the efficiency, or rather inefficiency, of the system and the availability or inavailability of the solutions that make it better. And the volume of the medical solutions market of Ukraine stands currently around $3 billion. Out of that, about 30%, or 1 billion, that's medical solutions. So you have that as your playing field. Also, what makes the medical solutions market different from pharma, and that's where life is easier for medtech companies than it is for pharma, is that because of the lack or low availability of venture capital and capital for startups, and those support networks and incubators for startups, it's not on the same level as they are in Sweden. We don't have a lot of Ukrainian medtech solutions that are very highly technologically complex. And that's where Sweden delivers a unique selling point and really has value and really has a lot of solutions that Ukraine cannot make. And the only ones that you will be competing with are other foreign manufacturers that are, and I think that there we are equal in that way. But when it comes to pharmaceuticals, of course, when the patent expires and it's generic manufacturing, of course there are powerful pharmaceutical companies, powerful factories with a large capacity in Ukraine. You'll be facing competition from those. But as we know from some of our member companies, trying not to look at you, there are success stories there as well. I say, first of all, do your homework, sign up for all the alerts, and look at the whole ecosystem. It does depend on your solution very, very much. But if you're looking at the needs of the moment, and if your solution has been unheard of on the Ukrainian market before, doesn't have any users, you don't know what the reception of that will be among key opinion leaders or patients, try the direct procurement from charities and NGOs. Oftentimes, they know how to get your product into Ukraine customs free, and they also can buy things from the manufacturer without such a restriction on the price.
If you're not present on the market, as many of you expressed, you need to find a good distributor And distributor search is something that Business Sweden, Britta, can represent Business Sweden here, that you can get help with on the market, because I think that's crucial to do a proper due diligence and make sure that you find the right partners for your product.
When I was writing this report, one of the things that I came to in the end is you think about a country in war, a country that has a lower growth per capita GDP, spend on health, and I mean a relative and absolute unpredictable in a number of ways. I think historically, the level of trade between Ukraine and Sweden, I mean, let's just say it could be more active and it should be more active. But from all the factors that we looked at in our reports, it just becomes clear. In many ways, in 90% of ways, Ukraine is just like any other market. You have to look at your strengths, weaknesses, opportunities, and threats, all that school book stuff. And you have to see who your partners are, find a good distributor or an agent, because the public hospitals or the hospitals connected with the public healthcare system, they all work with tenders. So it's tender announcements in the system called Prozoro, and the report deals with that as well. And Prozoro does have an English version, but it is in Ukrainian. And there is a history of foreign entities taking part in tenders and winning, but it's hard. I think it's because one of the things is the logistics. DTP is like the delivery terms that they require, and then you have great difficulty in complying with that if you don't have a local representative, local office or a distributor or an agent. It has been done as part of a framework agreement or emergency supplies, but it's difficult. So the search for a distributor or a partner, this is probably the most, it's the make or break of the idea that you have. And Business Sweden can help with that. Oh, recommendations, just very, very quickly. Gauge the need. Set up alerts for all the tendering systems. Everyone has one. The World Bank has one. USAID have one. Even the big charities have their tendering systems with alerts. Be the first to know of relevant opportunities and do proactive monitoring at least once a month. You will find that for international agencies, their requests and their tenders are a little bit all over the place. For example, for the United Nations, 1 month there's a big tender for a vaccine project. Then there's a tender for, let's say, prevention of gender-based violence and reproductive health. And you think, but I'm neither of that. But if you have the alert on and you watch it, then you know how to respond suddenly. It might be exactly up your street. Work directly with healthcare institutions and local governments to verify needs and build relationships. Because it is those governments, or those institutions, those hospitals that send out the request in the system, even World Bank HEAL, which is a loan, total size, $500 million. They work via the Ukrainian Ministry of Healthcare, and there is a special form, and there is an email address. I find it so cute. If you want to apply for the $500 million, use that email address. And the institutions will do that, I hope. But the majority of those funds are undisbursed because that's a loan. But that's the question of the day. How do you make sure that healthcare solution then, or the healthcare institution, in their bid for the HEAL funding, how do they actually connect to your solution and to what your company has to offer? Because you have to communicate, of course, communicate clearly, transparently, and honestly, like everyone else should, to make sure that your solution is heard about. As soon as you're ready, be bold and bid with your company, with your agent or your distributor. Also in Prozoro, the thresholds are very low and the fees to participate are very, very low. So it's easier than you think. Approach NGOs and private institutions as well, because oftentimes that will be the first experience of using your product. It will be those NGOs who are able to connect with the patients much more directly, much more efficiency, there's less hassle. Think positive, be ready for your own success. So when you do all these things in step 1, be ready for the fact that will lead to actual business. It does happen, and it happens more often than you think. We also have the broad Team Sweden to help you with this. We have EKN. I don't know if we have... EKN have a credit guarantee facility that is meant to support businesses doing work in Ukraine. We would like to see all of that being taken up by our wonderful healthcare companies using that opportunity. If your of course, plan for a distributor agent local office setup. If your solution requires extensive assembly or technical service, you should also broaden your search. And I mean, this is now maybe just self-explanatory. Consider the regulatory side, use the help of Team Sweden, talk to your insurance and bank. And you would think that it's the Ukrainian banks that are de jobbiga, but that is not always the case. We've had situations or stories from our members that have had difficulty getting money from Ukraine into their Swedish bank accounts, and I had to open a Baltic intermediary in order to even get the money. So talk to your bank before. Think above and beyond. So other European countries and their facilities, such as the German Technical Cooperation Agency, Expertise Français. If you have daughter companies in other European Union companies, you might be qualified for their support schemes as well. This is good to know. If you are a service provider, consider being an implementer or partner for a national aid project. I mean, I am thinking about USAID first and foremost and management consultant companies. This is maybe a much more rare fruit to pick, but this is a decent project to engage with. Engaging with someone like USAID, you can be in business for 5 years, for 10 years, working on projects of sustainability as delivers huge value to Ukraine, huge reputational value for you. International aid to Ukraine will continue for years to come, so plan for the long run. Currently, this is not a cash-strapped country. There is budget available to make the healthcare system work better than it did before. So I urge you, I mean, as a business-minded person and as a Ukrainian, I beseech you to please, please, please make use of these opportunities.
Great. Thank you so much, Anna.
Thank you.
So moving along, we will soon start with a pitch session. But before that, we also wanted to make you aware on a few incoming delegations that we have in the near future. We have one incoming delegation end of November from Protes Hub. Yeah, 2 universities will come. Protes Hub is an organization working within the prosthetics and orthotics field. They're putting up master level program in Ukraine on that. We want to make sure that they engage with the private sector. So of course we do have company friends here, but we also want to look broader, people with mobility and disability sector. How can we engage with them and make sure that they meet with these stakeholders, because the knowledge that these people sit on and the policies that they will make will be crucial for the population when war is over, that things are, the policies are in place and things like that. So government agencies, we will reach out to you as well to make sure that they learn what legislation, etc. we have in place. So that's Protes Hub. They're here from the 25th of November. We also are in discussions with managers of hospitals and clinics through Steadily. They are mainly hospitals and clinics close to the border. And Steadily, they are then communicating on the actual needs in the hospitals and clinics around that area and match the donations from USAID to cover that. So we're looking at dates for that. But with that said, we'll also do some information sessions towards the Ukrainian professionals. So some of the information that we have on Health by Sweden, other platforms, we will translate to Ukrainian, because we hope that, telling our story on the patient pathway and things like that will be useful for our friends in Ukraine. So if you have a thematic that we shouldn't miss to have translated, let us know.
Filar as a company, we're kind of zoomed in on a small area within the medtech sector. We work in the field of prosthetics. I'm going to try to teach a couple of terms and try to get you to zoom in on a very small part of the business. And why I'm here is basically for the reason that if there's a possibility for us to work together with any other companies that we can jointly or piggyback on towards helping Ukraine, that would be very much interesting for us. And I just have a few things I wanted to share with you. You've all been watching Paralympics, right? Yep. So you know everything there is to know about prosthetics. No. Well, just so we don't work with flowers. So this is a family name. We're a manufacturer, developer of prosthetic devices. Somebody told me once that you need to make the content relevant to the audience. So have somebody who's human-shaped and add that person into what you're talking about to make it more relevant. So here's Artyom Arakelian, and he's wearing two prosthetic devices. A prosthetic device is obviously when you have lost a part of your arm or when you have lost a part of the leg. That's when you interchange that for prosthetic device. We got to know earlier that the mean or the average life expectancy in Ukraine is around 65 years. Today in Sweden, most amputations are done on this level. You're like, what's that? Everybody knows Blade Runner, right? In Sweden today, most amputations are done on a lower level, so leg amputations, and it's right around the age of 75. So with the average life expectancy of Ukraine today, they don't even reach that. So why is then prosthetics relevant? Well, you probably already know the answer. We also provide something called orthotics. An orthotic device is something that is supporting an existing limb. Prosthetics and orthotics. Now you know a lot more than most people know about prosthetics and orthotics today. So what we have been focusing on is, for example, Per, who's a Swede. He fell down a lift shaft and injured both of his legs. What we are focused on is to develop something that can make his everyday life a little bit easier. However, the problem that we have in Ukraine today is not just these devices, but we're talking about these people. So this is Pete, and this is Sana. They are, follow me here, prosthetists. Try to cementate that in, not prostitutes, they're prosthetists. Important difference there. So what we see a big problem with today is that in Sweden we have about 280 prosthetists working in our industry. We have about the same number of prosthetists in Ukraine, but the demand is a lot higher. So just to give you an understanding of how much higher, don't tell our marketing department I did this because they're not going to like it, but in Sweden today we have about 280. We already figured that one out. And about 760 people are amputated every year. And do you know those hand creams? Those big round things that you like put hand lotion on your hands and they say hand restoring cream? Just for your information, that's the weirdest marketing campaign ever because they don't work. So every year in Sweden, if we have 760, they're gonna be amputated for life, obviously.
Due to the hand cream.
Yeah, it's a cause of the hand cream. I mean, we would like to have a hand restoring cream that would actually work, but since it doesn't, we have 760 average, increasing the amount of people living with a amputated lower limb or upper limb. Every year we add into how many people are living with a prosthetic device, with about that many in Sweden. So with those 280, that's sufficient. We can take care of that. But as I said, we have Ukraine and about the same number, and this is hard to estimate, but we put about the same number of prosthetists, right? And how many, take a guess, how many do you guess, or how many do you think live without a limb in Ukraine right now?
100,000.
50,000, 100,000?
7,000 a year.
7,000 a year? So let's just take an average of that. I calculated quickly and did like roughly 54, because 100,000, that's an average, that's an outlier, but about 54,000. So if we have 280 and 54,000, that means that we have worked for 67.8 years now. So we have a lack of prosthetists in the Ukraine as we speak.
And the amputations look different than in Sweden, I guess.
Exactly. So let's come back to Mr. Artyom. In Sweden today, we have about somewhere between 3 and 7% of the total population that are amputated have an upper limb amputation. So this is a very small part of what prosthetists work with today. So we have about 10 prosthetists working with specifically with arms today in Sweden. But right now, since we have about 54,000 people living with limb loss in Ukraine, and we don't have 4%, we don't have 3.4%, we don't have 7%, it's more or less 50-50. So take that number, 54,000, we divide that in half. Now we're down to 27,000 people living with an upper extremity limb loss in Ukraine. So how can we educate? That's obviously why we're very interested in having Proteus Hub over. How can we work with universities? How can we work with the Swedish university? For your knowledge, we only have one university in Sweden which is providing education towards becoming a prosthetist.
And they are covering the Nordics, aren't they?
There are actually more. We have one in Helsinki, we have one in Sweden, we have one in Norway, and we actually have a new one that started in Copenhagen earlier this year.
But are Jönköping the best then?
I think so.
Yeah.
Obviously, but I'm Finnish, so I would maybe say something different. But so what we would like to see is a cooperation in some way where we could have a piggyback on somebody who works in education. Do anyone work with education? Perfect. Do anyone work with supply chain? Supply chain towards supplying Ukraine with goods. The reason for me being here is we are now trying to understand how can we effectivize education, how can we simplify supply chain, how can we basically make prosthetic devices easily accessible for the users that need it in Ukraine.
Thanks so much for this opportunity, and I'm Karolina Goransson. I work for ACT Church of Sweden, so representing an NGO. ACT Church of Sweden is the international aid part of Church of Sweden. And I'm here really to share some lessons from our experience of working with Ukrainian civil society organizations since 2022. I will keep it brief and focus on the actors within the health sector that we have worked with. And there, my main partner in Ukraine is a large Ukrainian civil society organization called the Alliance for Public Health. And they've existed for 20 plus years, working in Ukraine through local member NGOs, non-governmental organizations around Ukraine. So they're represented in the majority of the oblasts in Ukraine. And they work on public health issues. They started out focusing on people living with HIV and AIDS. So that's their sort of expertise. But since then, they've also branched out into tuberculosis and also groups that are especially vulnerable and being their sort of voice and ensuring their link to to the healthcare system. And I was very pleased with the report's presentation, and I'm looking forward to diving in and reading more, that the NGO's part in the healthcare services in Ukraine was covered. Because, yeah, it was really, really good to see. Because from what I've seen working with Alliance for Public Health is that they do represent particularly vulnerable groups. And they are very well coordinated with the Ministry of Health. They worked with the Ministry of Social Policy to develop standards for that are being used to this day by the ministry. And of course, at their local and regional level, they work with the regional and local administrations as well to ensure connectivity and ensure that there's no duplication. And since the full-scale invasion in 2022, they've also branched out into more humanitarian endeavors and looking and adapting to the increasing needs of different groups. So just to tie into what the previous speaker was talking about, they've supported local grassroots initiatives to work with veterans who've needed to become amputees and to rehabilitate back into society and civilian life. And so the public health aspect of the healthcare service is really important at the moment and also for the future. Why am I telling you this? I don't have a product to sell. I don't have a project to pitch per se, but basically you represent companies and you represent ministries and you represent institutions that have a very great possibility to contribute positively to Ukraine. And I think ideally my partner would be here speaking for themselves, but I think that when you engage with Ukraine, with your counterparts, be they ministries, be they administrations, or be they private sectors, remember the Ukrainian civil society. Thank you. And engage with them as well. I'm pretty sure that your counterparts will be already. And their expertise and experience in working in these areas, I think, is something that could benefit us all, and not in the least the people of Ukraine, who are trusting them greatly, and they will provide that connection to the people on the ground.
My name is Masoud Jadidi from Emerging Care. We are actually providing remote patient monitoring or care at home. As you know, this is the huge challenge in Europe, not only in Europe, even the rest of the world, that the number of the elderly people is just increasing, lack of expertise, and more hospitals is getting very much challenges to get the right care in the right time. So what we are trying to do is in the national and regional wide, moving the patient from hospital to home and continue the care at the same level with a good quality. So I don't want to go through the challenges, you know better than me, but what is the important, this is one of the studies done with one of the region in Sweden we have, that you can see how it's affecting the primary care and the secondary care for different diseases we are talking about. And it's very known that 80% of the cost goes for chronic diseases patient. Actually, I had a 5 minutes discussion with the Minister of Ukraine, Health Minister, and he mentioned for me that the chronic diseases patient is not prioritized anymore, and we know why. And if you look at what he says, 20% of the divided the country, 60% still is the normal life they are doing. A lot of patient is there, and we know the number of the healthcare facilities is just reducing because of the war, and they get more challenges. So what I want to just jump at why I'm here, I want to present something that we have done it in Sweden, and we believe this is the key of solving small part of the challenges in the Ukraine. Today, usually we call it gatekeeper is our GPs, in primary care. Sometimes can be single doctor in the hospital as well. And what is doing that the process to getting care in the right time is getting very, very long time to get in the hospital, you know, very much the long queue to get the specialist care and so on. What we have done is the real project. We call it central monitoring team as a gatekeeper. What they do, they targeting the right patient group. I'm not talking about single patient. I'm talking about 500,000 patients, hypertension or heart failure or asthma, getting in the patient the right tools, the app they have, patient app, and getting connected to the right caregiver. So very short, why we are doing, because we are connecting the entire care system. So it's not dependent on primary care or the hospital, regardless where the patient is going to be. So everybody has the same information. Even the patient has 2 years old of the diagram of the hypertension, both the hospital and the primary care and the specialist care and elderly care, everybody can see the exact same information. This is what we are running in the region Jämtland Härjedalen in Sweden. So what we have done, we have a centralized monitoring team. There are only 5 people, the entire region. What they do, they monitoring, targeting the right patients, and they communicating with the rest of the caregiver in the region. So this is my last picture is exactly the result, what we have done. When we started the project, centralized of the monitoring, they had 544 patients on the platform, and after 1 year, 2,265 patients. So this is the efficiency of giving the care to the patient.
Hi everyone, my name is Jonas Segerstad. I represent the NGO One for Ukraine, and together I have my sidekick, Anders.
Hi, Anders Soxbo, sidekick to Jonas.
He also covers my 6. He's an ex-military, so sometimes I need him. Anyway, when the war started, I called Anders, what are we going to do? How are we going to help Ukraine survive this? And we found a niche that was totally left alone. There were no NGOs trying to fill this void. We found medtech, advanced medical equipment, and through a friend of Anders, working as the first secretary of the embassy, the ambassador of the Ukrainian embassy in Stockholm, we found a hospital in Kharkiv, the Decisive Institute. We raised 50,000 euros worth of medtech that we bought using different vendors, among them Getinge. You can scrolla ner lite. So this is the type of equipment that we have bought and what we are getting. And you see the numbers, they're quite high. So the 50,000 euros, that's what we raised in 6 months. And after 12 months of working, this equipment helps us, we save lives at a cost of 83 euros per life. That is pretty low when it comes to saving lives, I think. We held a couple of fundraising dinners at the Sprit Museum in Stockholm. So after the second dinner, we spoke with the director of the Sprit Museum. We had a great success with the pilot project. We should do this a lot bigger. Let's not do it 10x. Let's not do it 20x. Let's do 2000x. So our goal is to raise 100 million euros to save 2,000, the number of people that was saved so far. We need this by getting sponsors. We need this by getting contact with different businesses providing us with equipment. The One for Ukraine, as an NGO, we're here for the long run. We expect the war to end in 2025, 2026, but the need for our help will be there for 10 to 20 years. So the money that we raise and the equipment will be there for long term.
Yeah, and our idea was to minimize corruption. So instead of sending money, we bought the equipment directly from these larger companies. Getinge was one of them. And we made sure that the delivery arrived basically at the doorstep of, in this case, the Kharkiv Institute. And afterwards, we also received the footage films of very advanced operations on patients. So zero corruption. And every euro that was spent on that, buying the equipment and not administration. So we were happy about that. So this was the pilot. One for Ukraine was the follow-up, which we're focusing right now.
We have a conflict in the Baltic Sea that involves all the countries involved in the Baltic Sea. Our goal is to create a large voice of all the people here that will basically help us stop the war. So next year we plan to have a large event celebrating where we summon the people of the Baltic Sea and the raise of the 100 million euros. It's just me and Anders here tonight, but we have also the director of the Sprit Museum, Christer Mellstrand, and Laura Sprechman, which is the former CEO of the Nobel Prize public company. So the people that we have here, I'm just an ordinary person. I worked 17 years as an naturopath. Anders,
I rent out properties. I assist embassies, among them the Ukrainian embassy. So that's what I do. I have 3 kids. Any spare time with 3 kids and 2 companies, I spend with Jonas on this project. And I also see Olesia is standing over there. She's also a very important person in the project.
She's our Ukrainian connection.
Yeah.
Basically, this is a team, and if you know any sponsors, either cash or equipment, please contact any of us, either Olesia, me, or Anders. Thank you.
My name is Daniel Rickardsson Persson, work within OneMed Sweden AB, part of the Asker Healthcare Group. OneMed is the biggest distributor in the Nordics within consumables and medical technical equipment. Sweden is our home base, where we have our biggest footprint, and we stand for the majority of the deliveries of consumables, Swedish municipalities and regions. We have a large footprint in the Nordic. We have somewhat a large footprint in the European countries throughout Asker Healthcare. We are about to take the next step of the journey and go into Ukraine to see what we can do, how we can support, and how we can help. We are a reliable partner to the healthcare sector. We have a long experience within the civil preparedness, within the military preparedness, and we have based all of our concept and systems on that experience. We are not selling a specific single product. We are selling a service. We are selling something that we are calling system solution. It's a capability on the military side to build everything from role 1 to role 3, more or less as a turnkey solution. And on the civil side, the equivalent from role 1 to role 3, where we also could then support within education and within logistical resilience. What we say is that normally to reach out to our customers to bring value, we handle the 3-4 part logistic systems, and we have our system solution concept. It is a customer-specific service where the customer by themselves decide upon what they will, what their need is, and what they would like to have, based on a form, fit, and function concept, meaning that we are brand neutral. And I'm here today more or less to reach out to all of you in the room to build partnership and strong partnership I mean, it's the form, fit, function that we concentrate on. It should be adaptable to the specific situation, either if it is a military or civilian situation. We are very interested in partnering up with companies within consumables and medical technical equipment.